All right, the next question comes from Bruce. And Bruce's question is, how do I rehab a piriformis muscle? Okay, and this is a good question, because I'm hearing more of this both in my clinic, and I'm seeing this on the internet, that people are being diagnosed with what we call piriformis syndrome, and then they need to rehab their piriformis. Now, the piriformis, if you don't know, is a muscle that's located in your gluteus maximus area. Okay, and what can happen is sometimes this muscle can go out of balance. Now, part of what we do in our clinic, and part of what happens with rehab, is what we do is we identify muscles that are out of balance. Okay, so if somebody has a piriformis muscle that's too weak or too tight or needs to be rehabbed, what it means is something's out of balance, causing the muscle to either get looser, which means that another muscle is compensating for that activity, or that muscle then has become overactive and is trying to compensate for a different muscle. Okay, so either the piriformis is compensating for a muscle that's not working, or there's a muscle that's working more than it should, and now the piriformis muscle is not working. Okay, it goes both directions. So what we do is we identify, and it's very important that you identify muscles in or out of balance. So what we look for is we look for muscles, and we have you do certain motions. We have you do a functional movement evaluation. We look to see how well things are moving. When they're not moving properly, it means certain muscles are doing work that they shouldn't do, or not doing work that they should be doing. So then we address that issue. So there's no one way to rehab a piriformis muscle, okay? Because I don't know what's wrong with it. It's either overactive or underactive or compensating or not compensating. So what we do is we identify which muscles are working too hard, which ones are not working hard enough, and then we balance them out. Okay, it's very important. A lot of the pain that you have in the low back and what we call the sacroiliac joint, which is right at the hip line, is we look for muscles out of balance, because muscles out of balance are going to load pressure on joints. Too much pressure on joints causes you pain. Piriformis probably is not causing you pain. It might be an irritation to the sciatic nerve or an inflammatory process, but things are out of balance, and we balance them out. And if you don't balance them out, you will have the problem the rest of your life. That's it. That's your answer. Thank you.